What are the clues to distinguish COPD and asthma? Imagine trying to solve a puzzle where two pieces look very similar but fit into different spots. That's what diagnosing respiratory conditions like COPD and asthma can feel like. Both can cause wheezing, coughing, and shortness of breath, but understanding their differences helps doctors give the right treatment. Let's look at some clear clues that help tell them apart. First, think about when symptoms start. Asthma usually begins in childhood or teenage years, often with sudden episodes of breathing trouble. COPD, however, is mostly diagnosed in people over 40, especially those with a long history of smoking. If you're an older adult with breathing issues and a smoking background, COPD is more likely. Next, consider smoking history. Smoking is the main cause of COPD. If you have smoked heavily for many years, this points toward COPD rather than asthma. Asthma can happen to anyone, whether they smoke or not, but COPD almost always involves a significant smoking history. Now, look at how symptoms develop. Asthma tends to come in attacks or episodes that come and go. These flare-ups can be triggered by things like pollen, dust, or exercise. They usually improve with medication. COPD symptoms are more constant and gradually get worse over time. If your breathing problems are ongoing and slowly worsening, COPD is probably the cause. Triggers for airway inflammation also differ. Asthma is often triggered by allergens like pollen or mold or physical activity. COPD is mainly caused by long-term exposure to irritants like cigarette smoke, chemicals, or fumes. Knowing what makes your breathing worse can help your doctor figure out which condition you have. The most reliable test to tell them apart is spirometry. This test measures how much air you can blow out and how fast. In asthma, lung function usually improves significantly after using a bronchodilator medicine. Your forced expiratory volume in 1 second, or FEV1, can go up by at least 100 milliliters and 12%. The ratio of FEV1 to forced vital capacity, or FVC, also returns to normal. With COPD, the airflow limitation is not fully reversible. Even after medication, your FEV1 and FEV1-FVC ratio stay low. A post-bronchodilator FEV1-FVC ratio below 0.70 indicates COPD. Your medical and family history also give clues. If asthma runs in your family or you have allergies, asthma is more likely. COPD is linked more to environmental exposures and smoking, though genetic factors can play a role. When you visit your doctor, they will ask about your symptoms, when they happen, and what makes them worse. They will listen to your lungs and review your medical history. Spirometry alone isn't enough. Your symptoms and risk factors must support the diagnosis. One of the key differences is how your lungs respond to medication. Asthma usually shows a big improvement with bronchodilators, meaning your airflow gets much better. COPD, however, shows little to no improvement because the airflow limitation is not fully reversible. Getting the correct diagnosis is very important. It guides the right treatment plan and helps manage the disease better. Misdiagnosing COPD as asthma can mean missing out on treatments that slow disease progression and prevent flare-ups. That's why understanding these clues is so helpful for both doctors and patients.